In 1948, the United Nations founded the World Health Organization with the main goal to fight communicable diseases and to have a global tool to be a shield against emerging pandemics. Probably one of the most important tools to fight a global pandemic is a global body which is actually able to react very quickly to threats to global public health. And while the WHO was founded in 1948 to do that, over the last couple of decades, the WHO has developed into a very politicized body, which most likely suffered from mission creep and has the wrong priorities. So if you look at the United Kingdom, which is one of the main funders of the WHO, with more than £100 million annual membership fees, probably much more other hidden contributions, because it's extremely hard to actually understand how the WHO is funded and who's paying for what, which is a transparency issue I'm going to talk a bit later about. Western governments and liberal democracies and taxpayers in liberal democracies should ask themselves whether the amount of money which goes annually to the WHO is actually well spent when it comes to combating global pandemics. And the WHO has started becoming more and more interested in so-called non-communicable diseases, which is obesity, which is combating smoking. But actually when it comes to strong ad hoc emergencies, the WHO has over and over shown its weakness. And a very good example of this is the 2014 Ebola crisis, which I actually was fairly closely engaged with because I was in Nigeria down then when Ebola broke out in West Africa. I was actually at the airport in Lagos when the first patient in Nigeria collapsed at the passport control, about an hour before I went through immigration, which was a pretty scary thing. And one could see that Ebola, the first Ebola cases of that 2014 crisis actually emerged in late 2013 in Guinea, in West Africa. And it took the WHO till August 8th of the next year of 2014 to declare actually a global public health emergency. Following the news in May, June, July 2014, you could already see that there was like hourly coverage on global news channels. Probably you remember like all these images of US nurses in suits being shipped to, or at least in these epidemic suits being shipped to West Africa. But the WHO actually did not really want to engage in this and call it a global public health crisis. One of the main reasons, which later has been found out by a committee, was that some WHO members heavily complained after SARS in Taiwan and other Asian countries which said they suffered because of hysteria around the bird flu. The WHO was worried to upset Western African governments by declaring a crisis too early. Therefore, they decided to stay behind and be reluctant. The World Bank actually jumped in first in early summer 2014 to commit $200 million for rapid response aid. The US military jumped in, but it took Margaret Chen, back then the Director General of the WHO, another 2 months to really call Ebola an international public emergency. And this was definitely time lost. Tens of thousands of people died during that emergency. Very bitter story is that same summer, the WHO published a report focusing on Guinea, a country which suffered from more than 2,500 deaths caused by Ebola. And instead of focusing on actually that immediate problem, the WHO decided to focus on fighting smoking in Guinea by releasing a report, which I quote, talks about attractive young women which are hired by tobacco companies as marketing executives, but in reality serve as so-called cigarette girls, whose duty is to promote cigarettes at nightclubs in front of retail shops and other public spaces. That report concludes that this is a huge problem in Guinea, that in a country with high youth unemployment and a lack of actually gender equality, that actually some young women are able to make a living by promoting cigarettes, and that is a problem of global public health and not the vast Ebola outbreak. So this is like one of the many examples of the mission creep and the lack of focus of the WHO on global pandemics. 3 months after the WHO declared Ebola as the global public health emergency, Margaret Chan, back then the WHO director, spoke at a conference of the WHO in Moscow, saying that tobacco control is the organization's biggest priority. So in 2014, probably in the last 2 or 3 decades, the year where global media and global attention was as much as very much focused on actually a global public health threat, the WHO still did not see this as the biggest threat to global public health, Ebola, but fighting tobacco. And the WHO's ignorance towards such problems can not only be seen in Ebola, even though it's a very sad example of its incapability to act fast, but also looking at the fact that the WHO only declassified homosexuality as a mental disease in 1992 and still sees sexual orientation as a medical problem. Recently the WHO actually this year classified massive video game playing as a mental disorder. So the WHO is very busy with involving or like judging about people's lifestyles. It took them many decades to get at least rid of their institutionally communicated homophobia. Shows also that the WHO is more driven by many of the illiberal members than actually of the main funders, which are the UK, the United States, Canada, Germany, Norway, some of the most liberal and tolerant countries, which are actually the main funders of the WHO, do not have much to say when it comes to actually the policy decisions of the WHO, which still massively show homophobia and an intolerance towards liberal lifestyles. Another example is the WHO's reluctance towards embracing tobacco harm reduction, vaping, e-cigarettes, heat-not-burn products, even though there is massive scientific evidence that it's much less harmful than smoking traditional cigarettes. The WHO is very dogmatic on this. Either you smoke and die, or you just do not consume nicotine and tobacco. But a middle way, which is, for instance, is communicated by the NHS in the UK, and Dan Pryor is going to talk more about this, is being massively ignored by the WHO. Which is another sign of politicization, because it's not about science, it's just about being against something. The problematical political connections of the WHO are also shown by the very very well-known example of the recently elected WHO General Director Tedros Adhanom from Ethiopia, who actually named Robert Mugabe as a goodwill ambassador of the WHO. And for once, actually, the WHO was in the global headlines, and the outcry was so loud that after a couple of days, they had to revert this. But another example, which is not so well known, is that during that same time, Adhanom appointed a Russian health official called Teresa Kasaneva in a fast-track procedure without additional hearings to the WHO's leadership team. So a Russian official became very quickly one of the highest-ranking officers of the WHO as a goodwill sign to the Putin administration for their support of Adhanom's election to become WHO's Director General. And this was massively criticized by the TB community. This Russian official, Mrs. Kazaneva, is now overseeing the global TB program of the WHO. She's apparently not an expert on this issue, but has been politically pushed. And since the current WHO General Director had to say thank you to his voters, including the Russian government, someone who's questionable when it comes to actually competence in TB is now overseeing such an important program of the WHO. Another examples, and my colleague Yael Osowski is going to talk a bit more about this, are on certain conferences of the WHO where countries' human rights violators such as Iran and Syria are being praised for their fierce fight against smoking, but the human rights atrocities happening in these countries are being ignored. And these conferences are also mainly paid by taxpayers from liberal democracies, who then see that with their money, illiberal countries are being praised for killing their own people. It's not just about praising dictators, it's not just about ignoring facts or like health threats like Ebola, but it's also about wasting money. So the WHO's, and those numbers are from the Washington Post, the WHO spends around $200 million a year on travel for its staff. That's around 10% of their total expenditures. That's around $28,500 American dollars, so 22,000 pounds per staffer they spend on travel. That equals the GDP of countries such as Spain or Italy, GDP per capita, on what the WHO spends per staffer on travel. So do not think that every staff of the WHO is on the road all the time. They have lots of admin people, so it's a minority of WHO staffers who are actually traveling, are in the field, but you see first-class fares being paid and presidential suites being rented. When you get on a plane in Geneva, a long-haul flight, you'll see that there's still a Swiss first class. That's mainly the WHO actually paying for this. Just as an example, Doctors Without Borders spends per staffer a tenth on travel what the WHO does, and Doctors Without Borders is actually in the field and not at fancy conferences. So if we really want to help as Western taxpayers, if we want to help health emergencies in countries that need support, supporting nonprofits such as Doctors Without Borders is much more efficient than wasting money on the WHO, which also likes to host conferences. For instance, a regional African conference on the Seychelles, which is the most remote African country in the Africa region of the WHO, flying in all delegates from Africa to a nice resort to discuss comprehensive tobacco control laws. This probably could have also been done cheaper somewhere else. And the WHO has been criticized for its wasteful spending and untransparent methods. Therefore, they had to undergo an audit, and you would think if you undergo an audit, you have PwC, Deloitte, Ernst & Young, or KPMG coming in. No, the WHO picked the National Audit Commission of the Philippines, a country ranking 111 in the Transparency International Index, to audit the WHO. And the National Commission of Audit of the Philippines didn't find anything suspicious when auditing the WHO. So our money, again, is being spent, and then we have a very questionable audit office from a country where the rule of law is ranked very low and corruption is ranked very high, auditing this institution. We as the Consumer Choice Center therefore conclude that the WHO does not fulfill its mission to fight global pandemics, which is actually a danger. It's not just dysfunctional, but actually real problems might not be tackled because of the WHO's focus on being political, on fighting non-communicable diseases, and on having this mission creep, on not really focusing on actual problems. One example how to reform the WHO would be to temporarily defund it. Liberal democracies could defund the WHO temporarily. These funds could be used, for instance, by the World Bank to take up that slack of tackling global pandemics, and the funding should only be reinstated to the WHO if there was massive institutional reform, including having more control by the main funders of the WHO. So similar how the World Bank is controlled, that you basically buy more by actually contributions have voting rights and not just one seat, one vote.